Hi, my name is Sydnee with Knob Noster Physical Therapy. As part of the Dizziness mini-series, we are going to be talking about BPPV today. So BPPV stands for Benign Paroxysmal Positional Vertigo. It's a mouthful, so that's why we shortened it to 4 letters. But this can be described as that room spinning, dizziness, vertigo you may experience. So with vertigo, vertigo is not necessarily a diagnosis in itself. Vertigo is often a symptom of an underlying condition. So with that being said, BPPV does cause someone to have vertigo, which is that room spinning feeling you or someone you may have known has experienced. With BPPV, I have this little chart here that I want to show you. So in our ears, we have these 3 canals. They're oriented with planes of movement, so like up, down, side to side. And what these canals do is relay the information about where our head is moving out in space to our eyes and our brain. So if I close my eyes and I turn my head left and right, I know my head's turning left and right, even with my eyes closed, because this is relaying the signals correctly to my eyes and to my brain. So BPPV is what happens sometimes when this guy is not sending those signals effectively. You may have heard of crystals in our ears before. So these crystals are actually called otoconia. These otoconia live in this little house right here. When they break loose from this house and travel into these canals, that can disrupt the signal of when you move your head, and they're not like communicating correctly on both sides of your ears. So your eyes will start to spin and do some funky things until you stop moving your head after about 15 to 20 seconds. It's kind of amazing how this tiny little guy, this is blown up, but he is the size of a dime, even smaller. But there can be some big issues with this. So with BPPV, sometimes there is no rhyme or reason as to why it happens. Sometimes it can just happen. Other times I have seen, and in the research it shows, a trauma to the head. So if you hit your head in a car accident or you fall and hit your head, you can maybe knock a crystal loose. But the most common population affected by this are women over 40. So I don't know if I said this earlier, but the otoconia are made of the same material that our bones are made of. So there is some linkage between potentially having osteoporosis as women get older, and the strength of these otoconia. So that doesn't mean it doesn't affect men, because it does. It can affect men and women of all ages, but the most common population are women over 40. And as for treatment-wise, you're in luck. So physical therapists are trained to evaluate and diagnose and treat BPPV. It can be tricky because from person to person, it'll vary depending on which canal the crystal is in, which side it's in, and if that crystal's stuck or not. Sometimes it's just floating, but sometimes it gets stuck, and we have to do different things to get it unstuck. So depending on which way your eyes move, your eyes tell us a lot about where the crystal is, how your inner ear is functioning. So that's why we recommend coming in to receive treatment to correctly diagnose and treat this issue. As much as I want to say we can prevent it from coming back, there's nothing we can really do. But if it happens again, the treatment is very, very effective. If we do a maneuver 2 or 3 times in a session, you have a pretty good chance this crystal is back home where it should be, and you should be free to go about your day. So if you have any questions about anything we talked about today, we will be doing another video specifically on the treatment for BPPV with all the different maneuvers. But until then, if you have any questions, please give us a call or visit the website at knobpt.com, and have a great day. Thank you.